Start. What is atherosclerosis? It's accumulation of lipids in subendothelial layer of the vessel. Let us take and see how it's happening. First of all, to understand atherosclerosis, you have to refresh some information about lipid metabolism, fat metabolism. How fat transports in our body? It transports inside molecules. We call them lipoproteins. Lipoproteins. What is lipoproteins? Is an phospholipid membrane like this. Inside we have arachidonic acid, and there is some proteins. We call them lipoproteins because lipo is fat, proteins is protein. And there are different types, yes? We have low density lipoprotein, very low density lipoprotein, high density lipoprotein. According to what these names? According to density of proteins inside this complex. It means if we have low protein, less protein, it will be low density lipoprotein. Very low protein, very low density. High protein, high density. But you have to know some important information, that the relation between proteins and lipids are opposite. What does it mean? If high protein means low lipid. If low protein, very low protein means high lipid. That's why the harmful lipoproteins for our body are low density, very low density, because there are more lipid inside. High density is useful. That's why. Then atherosclerosis, what does it mean? When we transport lipids inside our body in vessels, this is vessel layer, this is vessel wall, muscular wall, I mean. This is endothelial cells of the vessel. This is blood. Now, how we transport lipids inside our body? We transport lipids according to need. For example, I need some lipids to liver. I take lipoprotein, for example, very low density lipoprotein. It goes to liver. Liver takes fat, what he needs. Then very low density become low density because he takes fat from the, and then become more protein. Then I go to other organ. I give fat. This organ takes fat. Then low density become high density lipoprotein, and so on. Transport, it's continuously every day according to needs, to necessary of organs. How it's happening? This is, for example, low density or very low density lipoprotein. It's came. I want to transfer this fat from inside this to this tissue. How it's happening? We have receptors here, and we have receptors, these receptors here. First of all, they have contact with the receptors. When they contact with the receptors, one enzymes is become active. Enzymes, we call it lipoprotein lipase enzyme. What he doing? He try to destroy this, and then fat will go crossing this wall to the side of tissue. What we need again, lipoprotein receptors, they connect together. Then this lipoprotein lipase become active. He try to remove fat from this complex to the tissue. Then fat in this complex become less and protein become more. Then low density lipoprotein become high density lipoprotein. Like this, it's happening. Now, what is atherosclerosis? According to this information, atherosclerosis occurs in mechanisms. First mechanism and most common mechanism is more fat in blood, hypercholesterolemia. It means that low density and very low density become more in blood because we have more fat in blood. Understood? Very high. Or there is rare cases, hereditary cases. For example, hypercholesterolemia could be familial hereditary case. It's occur in kids. Or receptors hereditary less. There are no receptors. Or lipoprotein lipase absent hereditary also could be. Understood? But the most common is hypercholesterolemia due to fat intake or obesity like this. What happened in this case? This transport, what I explained before, we call this transport regulated transport or legal transport. Legally. They cross the wall legally. When we have more fat or no protein or no enzyme or receptors become damaged or less, this fat try to pass or to cross the wall illegally. Illegally, what does it mean? This fat is green color. This fat try to pass the wall illegally. But so sorry, he cannot. He will be accumulated here in subendothelial layer of the vessel. Which factors can help in this case is the endothelial cell damage. If the endothelial cell is damaged, it becomes as a predisposed factor for atherosclerosis. Then this fat become here. Then tell me please, you, if the fat is inside in subendothelial layer here, is it normal or abnormal? It's abnormal, yes? We call this foreign body because here must not be fat at all. Then, so what if foreign body? Foreign body means we have to remove foreign body, yes? Who removes the foreign body? Macrophage. Macrophages become migrated here and come inside the endothelial layer. They try to engulf. Now they try to digest fat. But so sorry, they cannot digest fat. Why? Because they're using the mechanism, we call this mechanism pro-oxidation mechanism. Macrophage, their mechanism to digest microbes and foreign bodies by pro-oxidation mechanism. But so sorry, fat is already as pro-oxidant. So how can you pre-oxidate pre-oxidant? You cannot. That's why fat become accumulated inside macrophage. Here. We call this cell macrophage containing fat. We call this cell foam cells. Foam cell. So what is foam cell? Is macrophage accumulated with fat. She cannot digest this fat. Then what happened? By the time new fat coming here and new macrophage come and accumulation fat inside macrophage and foam cells. By the time become migration of muscle cells from muscle layer, from smooth muscles here. They also try to have as to engulf. By the time this fat causing what? Causing atheroma or atherosclerosis like this, causing narrowing of the vessel. By the time the most common complication of atherosclerosis is thrombosis. Why thrombosis? Because endothelial cells, they have 7 functions to prevent thrombosis. They have 7 functions to prevent thrombosis. If they are damaged here, these endothelial cells, then thrombosis would be occur. 7 functions of endothelial cells they are synthesize prostacyclin. They have heparin-like receptors. They have thrombomodulin receptors. They are all, we call it anticoagulant receptors. They synthesize tissue factor of plasminogen, which activate plasminogen into plasmin, and it destroyed fibrin tissue of the thrombosis. They also activate production of oxygen nitrate, NO, nitrate oxygen. Oxide, yes, nitrate oxide. These 7 functions of endothelial cells to prevent thrombosis. If endothelial cells are damaged, and they are already damaged due to accumulation of fat, then thrombosis will be occur. That's why most common position of atherosclerosis is coronary artery, causing ischemic heart disease with attacks of stenocardia. If thrombosis occur in coronary artery, then it will lead to myocardial infarction. This, in general, what you have to know about atherosclerosis. Thank you very much.